Mm. Next is about the vatavydhi, the vata abnormalities which can produce at different organs, involvement of the organs with vata. We will continue from the point where we had stopped last week. Now, the next is about the Tvagata vata. Vaivaranyam Spuranam Rausham Suttim Chumchumanam Tvakstho Nistodanam Kuryat Tvagvedam Paripodanam. Now, when there is an involvement of vata in the skin or the tvaka, the complications which can occur would be either there could be discoloration. Discoloration would be usually a blackish pigmentation. A blackish pigmentation in the skin, whenever you see the skin disorders, would be the most common cause would be vascular stasis. If there is a stagnation of the blood flow in the subcutaneous area, that pigments of the blood which get combined with the tissue over there, they become black. That iron would convert it into iron sulfate of the blood, and hence that would be a blackish color seen, and that black color seen would be one of the signs of water. So any skin lesion presenting with that kind of blackish discoloration would be considered as water. Or it could be erosion, the roughness. Roughness is again due to the keratin tissue, presence of the keratin tissue. So keratin and melanin, these are the two substances which give either the consistency or the color. Now, in a condition where there is increased melanin synthesis, also will be producing blackish color, as well as there could be a changes in the consistency of the skin. And such disorders where the keratin tissue becomes abnormal, hyperkeratosis, or abnormality of the keratin tissue, either it could be like the keratin tissue becomes thickened and then rough, or the keratin tissue may even become broken or cracks could be seen. Pagbhedam and Peripotanam. Pagbheda and Peripotana, these are the two signs, maybe the Rausha. These are the signs of either hyperkeratosis or other keratin abnormalities. All that conditions are, let's say, keratin abnormality. It is the keratin abnormality even can result in changes in the nails. And the Suktim or Chumman, sensory abnormalities, the nerve endings which are present in the skin, if they are not functioning normally, either there could be a hypersensitization, the skin may become hypersensitive, where the touch sensation may produce the pain. A simple touch stimulation may result in a pain sensation, or it could be numbness. So, Sukti or Chumchumana also could be the abnormalities. Or in summary, conditions where there is a vascular stasis, conditions where there is an abnormality of the melanin or keratin synthesis and abnormalities, conditions where there is a abnormality of the peripheral sensations can be considered as Vata Vyadhi. So when you see the patients clinically with the skin manifestations, and whenever these signs are seen, definitely we can categorize them as Vata Vyadhi and follow the line of treatment of Vata in such conditions. Next, when Raktada, Bharanamsha Raktada, when Vata immerses Rakta, it results in the superficial wounds, and the characteristic wounds which are produced are due to the vasculitis, inflammation, and abnormalities of the blood flow to the skin. Now, when the blood flow to the skin has become reduced, it characteristically initially presents with a typical hyperemic changes, and these hyperemic changes may result in a localized reddish elevation, papular lesion, and it becomes ulcerated. And when it becomes ulcerated, it will be quite painful, and it is a typical presentation of vasculitis, as a typical presentation of vasculitis conditions. And whenever we have these kinds of presentation, that too considered as the Vata Vyadhi involving the Rakta. When it is involvement of the Rakta, Vata Rakta varieties, different types of the Vata Rakta variety, or Rakta Vata, or so on. Now, Vata Rakta as a disease is a separate entity. It could be Rakta Vata. So you will see plenty of such patients in the world where the patients would have vasculitis-like conditions, and we treat them with the Bastis, Vata Vyadhis. Then, Granthi Sashulan Manasam Shita, when there is a firm nodular lesion in the subcutaneous area, Mansa is subcutaneous area, and when it is painful. Now, subcutaneous swellings could be of two varieties, painful or painless. Usually, the lipomas, the most common varieties, they are painless and they are not Vata, they are Kapaja. But other masses, like other not so common conditions could be schwannomas, neurofibromas, or the plexiform type of the neurofibromas. These are the very common variety. Of course, there could be many more of that variety. When they are produced and they will present with a swelling, that is the mamsa vata, mamsa vata vyadhi. So all that point is this vata and involvement of the dhatus that can be made out clinically and can be demonstrated, and it's a practical issue. That's all the point. Like Medashika, Korea, Grandi, Mandalajo, Aurana, when it is Mandalaja, when there is no pain or less pain, as in case of lipoma, that is a Medashika Vata. When there is a Medashika Vata or Kapita Vyadhi, it can present with relatively painless, relatively firm swellings. And another characteristic feature is that when Vata Vyadhi is there, a swelling is presented with Vata, it would be movable, chala. Whereas a swelling which is firmly fixed and it is painless, that's Kapaja. So that's how we can make out Vata and Kapaja and follow the line of treatment accordingly. So, Medashika, Kuriya, Granthi, Manadajaha, Avarna, it doesn't result in a wound. It's very typical of lipoma, but we see quite frequently. I'm just suggesting about only the frequent clinical conditions, and still there are many more. So to list all those conditions would be practically not possible. So I'll just refer to the treatment conditions. Kuriya Sira Chulam Sira Akunjana Puranam, typical of the vascular disorders, the arterial, peripheral, ischemic pathologies. Now, peripheral ischemic pathologies can present with the two sorts of the complications. Either there could be a simple spasm of the vessel, arterial spasm, or there could be inflammation, phlebitis, which at the end, in both the conditions, there would be a clot formation. So, Sirataha, Shulam, Sira Akunchana, or Apurana. Sira Akunchana, constriction of the vessels could occur, spasm of the vessels could occur, or it could be like there is a stasis, the blood flow doesn't occur, and hence it results in Shula, painful conditions. That's exactly the same issue. Now, we do now in the present situation, we make the difference between arterial and venous complications separately. Arterial complications, of course, can present with the later different consequences. Venous, they produce different consequences. But Sushruta doesn't made out that difference of the arterial and venous. It's about the vascular disorders of both varieties. Of course, there is a issue of difference in the dynamics of these two conditions. Consequences would be different, but from our clinical point of view, we can consider both arterial and venous disorders as a Sirakata Vata Vyadhi. It includes even the varicosities, where the arteries or veins become dilated, or aneurysms, where arteries become dilated. They also could be. Sushruta has mentioned about Akunjana. It could be like the prasarana also, where there could be dilatation also. So, in all these conditions, wherever it results in a stasis of the blood or abnormality of the blood flow, turbid blood flow, or what we call as eddies currents, that can be considered as a Siragata Vata, and Siragata Vata also is a practical clinical diagnosis. Snai Prataha, Samadhamu, Shulam, Akshepanam Tadha. Now, convulsive disorders, where the patient may present with clonic or tonic phase, or where there is the rigidity of the muscles. Now, it is not only the convulsions, localized rigidity of the muscles. Rigidity of the muscles could occur due to either neural lesions, or it could be due to any painful spasm of the muscles. If there is a painful lesion nearby, the muscles will go into gardening, and that also can be considered as the Snayagata Vata. So, Snayagata Vata could be presented as a systemic pathology, where it could be Akshepanam, where there could be tonic convulsions, or it could be localized lesion like Stamba and Kalamba. Fasciculations of the muscles, Kalamba, or Stamba, where there is a rigidity of the muscles, or it could be simply myalgia, pain. Even these conditions could be considered as Snayagata Vata. Again, from the clinical point of view, we can see plenty of such conditions. Neurological, myological conditions, or generalized conditions of tonic and chronic convulsions, all of them would have a consequence of Snayagata Vata, and the line of treatment can be similar. Then Sandhigata, हन्ति सन्धिगतसन्धेन शूलशोको करोत्या अस्थिशोषं प्रभेदं च कुर्यात् शूलत्यतच्छ्रितः. Now, when there is involvement of the sandhi and asti, it can present with the shula or shoka, swelling in the joints. Swelling in the joint could be due to two reasons. One, the fluid collected, effusions, or abnormalities of the bones, osteophytes. Now, osteophytic swellings, where the surface character would be abnormal, that's the typical of vata involvement of the sandhi, of bones or asti. Or when there is an effusion, now effusions in the joint could be of two sorts. When inflamed effusions, inflammatory effusions, exudative effusions, where there could be painful conditions, or hematolosis, blood in the joints, or it could be many times non-inflammatory effusions comparatively. Now, among them, the inflammatory effusions, where there would be painful swelling, as in case of rheumatoid arthritis, or it would be like in case of pyogenic arthritis like conditions, that could be an involvement of water as well as to a certain extent pitta in that condition. Whereas the other possibilities of water would be astishosham prabhedaja. Astishosha is the osteoporosis, the exact word. Astishosha porosis is the same word. There is a copyright issue. So Shukra has mentioned that word very specifically. That the bone or asti becomes fragile and the consistency also becomes altered, or prabhedaja. It can even result in abnormalities like osteophytes or even pathological fractures could occur, or all that abnormalities related to the joint, they are typical of vata sandhigata vyadhi, and it's also practically easy to make out. तथा मज्जागते रूपचन कदाचित् प्रजाम्यति, intractable pain, or what you call as a persistent pain. Now, any pain, of course, is a result of vata. Without vata, pain doesn't occur. But when it becomes majjagata, it becomes persistent. Persistent, what we call as a pain cycle. Now, a persistent pain cycle could occur due to any of the painful conditions, any primary condition can result in. But very often, it involves with a psychological component like stress or maybe the depression. Or that's how it is seen. Any painful condition, any simple trauma also can result in a persistent pain cycle. Now, what we call as the pain cycle is there is a pain produced to any condition which results in the muscle tone becomes hypertonic at the area, and this results in stress and then the psychological component. And this results in again a pain, and in such conditions, simple analgesics, the usual analgesics, may not be helpful in such relieving the pain, and the patient needs a specific treatment. Otherwise, often it could be like antidepressants or so on, or from our point of view, the specific treatment like Basti or Dailhara, that kind of treatment would be required. Very often you see these kind of conditions in very chronic pain like osteoarthritis, rheumatoid arthritis, and so on, because the pain is persistent for a long duration. There will be always a psychological component. You may have seen many of the patients where suicide is prescribed, or many times Dhara is prescribed. That's all the signs of Madhyagata Vata. Now, the point is that you may not, the origin of the disease could be something different. Or many types of the origin of the disease may end up in this kind of a situation where to break that pain cycle, you need to have the specific treatment of vata, and that's exactly the Madhyagata Vata. From the clinical point of view, very important and critical condition. Then, Shukragata. Aprabhutihi pravrutirva vikrita shukrake anile. Now, the whole mechanism of ejaculation of the semen itself is a very complicated and very coordinated mechanism. I will not go where you have a role of somatic as well as sensory. It is a sympathetic one. When there is a sensory input into the brain, that results in the sympathetic stimulation, and that results in the blood flow into the shaft of the penis, and the erection occurs. At the same time, simultaneously, the hormones will take part in the ejaculation and semen is discharged out. Now, this complex mechanism involves many layers of different functions. So, there is initially the these sensations. Of course, there is a psychological component, the higher central cerebral sensory input in terms of the touch sensation or maybe the visual sensation, and then the sensation has to be carried, and then there has to be integration in the higher center, and then executed through different systems, sympathetic, parasympathetic, and sensory systems have to get involved. At the same time, the hormones also have to get involved, and whole of these cyclical change, a coordinated, synchronized changes would be the functions of what? Whenever there is a breakdown of these, any of these components, that synchronization fails, that results in abnormal functions of either failure of ejaculation, failure of erection, or so on, or it also can result in abnormalities in the quantity and quality of the semen. All of them could be considered as Vata, Shukragata, or Shukragata, Vata. Now, Shukragata Vata is mainly where there is an abnormality of ejaculation, not that of the synthesis. Synthesis of the Shukra is a function of the Kapha, whereas the ejaculation and is the function of Vata. So, complex cycles involved in the ejaculatory mechanisms are Vata. But if there is an abnormality of the synthesis of the semen, like Jesus, and so on, that could be considered as a kapha. That's how it has to be differentiated. Then, Hastapala Shirodhatum Sata Sinjarati Kramata, Vyapmatva Akhilam Deham, Vayu Sarvagaton Ram. Now, this is a very important statement, and from the practical clinical point of view, it's a very important pathological phenomenon. A disease which can involve any one of the specific areas of the body, which could be produced at any specific area of the body, can get an impact on the through the body in different systems. It can result in a multi-systemic involvement. A disease which can result in a multi-systemic involvement is a complication of the Vata environment. Hastapada Shirodhatum Sada Sanjarati Kramata Vyapanyadva Akhilam Deham. That Akhilam Deha Vyapana is a multi-systemic environment in case of the Vata, which is also called as Sarvagata Vata. And that Sarvagata Vata can produce various symptoms. It could be convulsive disorders like Samhana, Akshepana, or it could be abnormalities of the sensation, swap, or it could be like localized swellings and pain, shofa, shula, and sarvada. So the symptoms could be of anything, or Staneshu, Ukteshu, Samishra Kuteruha, various mixed type of the complications, symptoms can occur, or Kuriya Avayava Praptaha Martha Samsangavana. It may result in involvement of any specific organ, and there could be an abnormality of the organ. Now, this is a very important physical physiological phenomena. To understand that physiological phenomena, I will be very brief. Again, I am not going into much of the detail, but you have to know about basics of what we call as a cytokine. Cytokines now, of course, after the pandemic of COVID, cytokines have become very popular. Every common man now knows about something about cytokine. But cytokine, of course, is a very important concept in the formation of the disease. Cytokines are really the sensors of the disease. So, for a person to know that you are diseased, there is an injury to the cell, any sort of injury to the cell, any sort of the abnormal functions of the body. If you have to be aware of that, the cytokines have to be released. Cytokines will make that job of making the body know that there is something abnormal. Now, once you know that there is something abnormal, there will be a connective changes. Corrective changes may occur at a subconscious level, where you are aware, or what we call as the physiological limits of the correction, which we call as homeostasis, or it could be like it may result in a clinical symptom where you know that you are diseased and you will be taking some remedial measures, or it is not simply the spontaneous correction which occurs at the subclinical level. It may present be a clinical level where there will be some interventions by which it can be resulted in the correction. Or if it is not done, then it may result in the disease conditions, present what we call as the involvement in the disease. This is exactly the thing. Now, cytokines are present everywhere. Sarvatraga, it is present everywhere. In every tissue, the cytokines are there. But for the sake of practical issue, we categorize the cytokines into two categories: organ cytokine sources and cellular cytokine sources. Cellular cytokine sources are present in the lymphocytes, mast cells, and so maximum are lymphocytes and mast cells. Organ cytokine sources are in every other part of the body. Maximum would be the blood and liver. These are the major areas of cytokine production. Now, many of those cytokines now are identified and they are named. Of course, the whole issue is very prolonged, which I will not go into that in detail. But I am just suggesting about the classification of the cytokines. They are classified now as adipokines, hepatokines, inflammatory cytokines, myokines, and osteokines, depending upon the source of the cytokine, and their functions are different, and they are again subclassified into their chemical names. There are innumerable numbers of cytokines. I will not just go into that. And then there is a interleukin. Cytokines, they will reach to the target cells and they will produce the stimulus, and their stimulus is dependent upon type of that intermediary chemical, which is called as interleukins. So the messenger between the cytokine and the real cells would be the interleukins, which are again mostly present in the T lymphocytes and the macrophages, which are responsible for the reaction, immune systems of the body. So cytokines and interleukins are the two major chemicals which are present in the cell, and interleukin now are named with that coded interleukin 1 to interleukin 12. These are now identified. Of course, now the latest is interleukin 13 and 14 also are identified, and their specific functions are known. These are known, but their utility in the clinical practice is still not very much. The whole approach of the treatment now would be to suppress the cytokine. See, you will have some medicines like glucocorticoids which can suppress the cytokines, but the cytokines, the functions is not to be suppressed. Rather, the cytokine functions has to be specified, targeted as such. Now, when these cytokines and interleukins are released in the body, cytokines are released and interleukins, of course, are produced response as such. The clinical symptoms or signs which can occur could be in any of the organs. It could be, now, this is exactly what Sushila has said. Sthaneshu ukteshu sammishra kurute vijaha kuryadaiva praptaha marutha samitangadam. This picture suggests about the same. It can be in any of the organ, like when it is in the lungs, it can present with the infective complications of the lungs like pneumonitis, so on, pulmonary edema, or acute respiratory distress syndromes. Or in the liver, it can result in hepatomegaly, enzymes changes, cholestasis, liver failure ultimately. Or in the kidneys, it can result in the renal failure or acute renal pathologies. Vascular, it can result in many vascular conditions, starting from simple cytopenia to the severe lymphadenopathy. Over the nervous system, it can start with confusion to seizures. Any of those clinical symptoms could occur, or it could be systemic symptoms like fever or the fatigue, which is very common. Now, most common would be any of once there is a cytokine released in the body, the commonest symptom would be a sort of fatigue, anorexia, and the fever. Now, fatigue, anorexia, and fever, these also are the protective symptoms. Now, we consider these as signs of the disease, and we try to tackle them in a different manner. But primarily, they are protective symptoms. Protective symptoms in the sense, when you have that fatigue, you will prefer to take rest so that the energy is conserved. And when the energy is conserved, it can fight with the disease. Anorexia also is a protective mechanism because the major utilization of the energy would be to digest the food. So whenever there is a disease condition, if you take more food, more of your energy will be utilized for the digestion. Instead, if you reduce the food intake, then there could be the energy utilized for the digestion. That's a very interesting issue. The maximum energy utilized by any person, whoever may the hardest worker, the maximum energy utilized by any person would be to digest the food which is consumed. And the target of that, purpose of that digestion of the food is to release the energy. So rather, you will be spending more energy to release the energy and to provide the energy to the body. And this is the real situation in the condition. And hence, whenever you use a food substance which is easy to be digested, you will be conserving the energy. When you consume a food which is heavy for the digestion, or it takes more energy, which is the concept of the Laghu and Guru, then there will be more energy spent for the digestion and lesser energy available for the physical activities. Now, anyway, that's a different story. When it comes to question of anorexia and gastrointestinal tract symptoms in case of toxemia, see, whenever we grade the toxemia, we grade the toxemia on the same issue. The first grade of the symptom would be fever, the next would be gastrointestinal tract symptoms, and then the next is systemic involvement. That's how we classify the toxemia conditions. Now, in that grade 2 toxemia, you will have the DH abnormality, and that DH abnormality also is to conserve the energy and provide the energy to fight with the disease. So that interleukin and cytokine immune mechanisms, they do their functions, and there would be a spontaneous correction. Fever also is a clinical sign by which a clinical result by which the body will be protected. When the temperature is raised, naturally the energy level would be more, and when the energy level will be more, the total production of the energy in higher temperature, the production of the energy will be more, and that more energy will be protecting that. But somehow, in the present days clinical management, the clinical management would be of a symptomatic management. The moment you have a fever, you will take some antibiotic, and whenever there is a anorexia, you will try to somehow consume more food by any of those substances which can improve the appetite. But that's not really necessary. Whenever there is a real disease condition, you have to divert the energy of the body to to tackle the disease by its own, and that kind of a healing which occurs spontaneously is always the best of the treatment. And hence, whenever the protective reflexes like the fatigue, anorexia, and fever, these symptoms are treated in a different manner in the contemporary situation, and from Ayurvedic point of from the Vata controlling point of view, the approach should be somewhat different. So anyway, that's all the point. Then of course, practically you will always have some practical problems like whether the patient would accept this or not. These are all the different sort of the questions. Anyway, that's another issue. But my purpose of referring to this issue is there is a important physiological principle involved in these concepts. That's all the point. And rather, many times it looks like Ayurvedic theories are more evolved than the contemporary theories. That's it. Then, of course, the cytokines which are present in the body, cytokine interleukin reactions can involve the heart, and then it can result in cardiomyopathy or maybe hypertension, or it could be in case of the joints, it can present with the periphery, vasculitis, and arthritis like symptoms. And gastrointestinal tract symptoms, as I told, nausea, vomiting, and so on, diarrhea, or it could be about the skin where there could be eczema, rashes, and so on. So, the symptoms which could occur due to a disease manifestation anywhere can result in the involvement of multiple organs and can result in the many established diseases. So primary involvement could be somewhere else, and this is well known in the contemporary pathology even. But somehow the practical utility of using this concept in the treatment is not so popular. Most of the times, what happens is when a patient presents with a specific involvement of an organ, all your focus will be over that organ, but that primary cause is not really seen. But Ayurvedic approach would be to tackle or to attempt to see that primary approach, and most of the times the primary lesion would be, or primary cause would be the gastrointestinal tract, the consumed food. So once you have corrected that consumed food consumption, or what we call as the Agni functions as a whole, I am not suggesting only about the food consumption, the whole function of the Agni, and once that Agni is corrected, then all that synchronized systems will be functioning well, and hence the treatment will be more targeted. That's how the difference between the approach of the disease in case of the contemporary and modern. But when it comes to the question of understanding the disease, physiology and pathology, virtually there is no difference. It's only about the difference in the words and the extent of the description. In Sushruta or in Samhitas, it's mentioned in a few sentences, whereas now you get tons of pages about these details. Now again, the same issue. a organ can get involved, or there is a interaction between one organ and the other. A cytokine released from one organ can result in involvement of the other organ. These are the examples. Like a cytokine released from the spleen can result in involvement of the heart, or a renal involvement initially can result in involvement of the heart or gastrointestinal tract. There could be the interrelationship, and this is again how a multisystemic disease could occur. Now we use that word multisystemic involvement, and that multisystemic involvement always suggests of a poor prognosis, and this is exactly how it can occur. That's about one of that. Then तासन्ताप मूर्छाः स्युः आयोः पित्तसमन्विते शैत्यशोफ गुरुत्वानि तस्मिन्नेव कफावृते सूचीभिर्वनिस्तोदः स्पर्शद्वेषः प्रसुप्तता शेषाः पित्तविकाराः स्युः मारुते शोणितान्विते. Now we have discussed about vata and complications of vata when it is involving specific organs or specific dhatus. But practically in the clinical condition, you will have the combination of the different doshas. Vata, Pitta and Kapha, all of them would be combined together, and impact of one would be always result in impact on the other. So you will always have a clinical symptoms produced due to multiple doshas. So it's not alone Vata alone which can be seen in all patients. And when there is an involvement of the Pitta, the clinical symptoms will be burning sensation, which is a well-known phenomenon. Everyone knows about that. That Pitta produces the Daha or burning sensation, and Kapha involves the Shaitya Shofa, sensations of swelling or maybe itching like symptoms, and the Kevala Vata will be presenting with the Suchi Bhirvanistodha, Sparshadvesha. There could pricking type of sensation and abnormalities of the perception of the sensation, and Sheshaha Pittavikaraha, Marti Shonitanvite, in the when there is involvement of Rakta, it results also in the same abnormality of sensation, hyperesthesia, and even the symptoms of Pitta. Now, there's another important question, like a patient may present with a symptom, and a patient may present with a pain, burning pain, a patient may present with the pricking pain, or a patient may present with the itching and so on. From the general, those who are very having superficial knowledge of the contemporary system may say that this doesn't make much of a difference. But if you know the contemporary system very well, you will make out the differences. Now, whenever there is a pain sensation at the end, now whenever you feel the sensation anywhere, it's all due to all that whole issue of release of cytokines starts with the initial chemical mediators of the inflammation. Whenever there is a damage to the cell releases some mediators of inflammation, and those mediators of the inflammation are made of different categories, and they are of two types. One, cell derived. At the type site where the cell is damaged, there could be a release of these mediators of inflammation, or it could be plasma derived, which can carry that sensation system into the whole of the body. And there are many which are identified. It could be histamine, serotonin, arachidonic acid, and so on. And of course, cytokines also are categorized among the same these mediators of inflammation. And then of course you have that complements also, like C3A, C3B, and so on. So my purpose is not to go into that. But the important thing is that when you have the more of serotonin, which is discharge at time of injury, particularly the cytokine of serotonin type, it results in acute pain sensation. The symptoms which are produced due to the release of the cytokines, particularly serotonin, would be muscle and joint aches, fever, chills, fatigue, swelling swelling in the extremities, nausea, headache, rashes, or cough. That's exactly what is mentioned due to the Vata Prakopa. Now, important is this. There is a linkage between the clinical symptoms produced to a specific tissue amine and the Vata Lakshana. Sramsavyasa Vradhaswapa Swadaruktoda Bhedanam Sandanga Bhanga Sankocha Varta Harshana Darshanam Kampa Parushya Saushirya Shosha Spandana Vestam. This is almost a translation of this list of the symptoms located over here, except a mu like cough. Of course, cough is not mentioned in that. Now, it is a well known. See, the point is again to make it very clear, I think. Say, suppose you have a injury, cut injury, trauma, and immediately after the trauma, the pain which you feel would be, suppose you have cut yourself, you will have some acute pain. Then after a certain period of time, you get the burning sensation as such. That's the usual course as such. During the healing phase, when the wound is healing, you may have that itching like sensation. Now, why these symptoms do occur? It's well known. It's understood in the modern philosophy, physiology also. But only the thing is, these principles are not utilized in the therapy. Whereas from Ayurvedic point of view, this is exactly the thing. Initially, at the time of that acute injury, it's the serotonin and bradykinin which is secreted more. And once the tissue starts getting inflamed, then you will have more of the prostaglandin like, which we also call as chemokines. Now, these cytokines and then there is a chemokines. These chemokines are mainly, their purpose is to make the leukocyte come over to the area, and leukocytes will do the function of either phagocytosis, or they try to heal, or maybe if there is a source of inflammation like a bacteria, it can be engulfed, and so on. So there is a fighting reaction, firefighting reaction, and that firefighting reaction is initiated by the chemokines, and prostaglandin is one of them. And whenever that is secreted, the clinical symptoms would be of the local inflammation. And local inflammation, temperature would be raised, there will be reddish discoloration, pain also will become more, and there will be edema. पित्तस्य दाह राग ऊष्म पाकिताः स्वेदः क्लेदः स्तुतिः कोथः सदनं मूर्छनं मदः कटुकाम्लो रसो वर्णः पाण्डुरारुणवर्जितः. All the signs of inflammation. Now, when I say inflammation, inflammation is something which is going to harm you. Inflammation, the whole target of the inflammation is to remove the non-viable tissue so that give some space for the new cells to come up. So and then at the end it results in healing. So it's not that everywhere you use the anti-inflammatory as a basic principle of the treatment. Inflammation is needed. Without inflammation, you cannot survive or you cannot live as such. But of course, it's true that the inflammation need to be controlled. It should not go beyond a certain limit. And this kind of a reaction would occur in every disease. It's not only in the trauma and injury, even cancer-like conditions or even any other immune pathologies, you will have the same. The chemokines will be released and there will be some sort of inflammation. Inflammation is also produced due to a consumption of the excess of food. A systemic inflammation is well known, and the chemokines are released due to consumption of the food. Even the extent are different, maybe the subtypes are different, but at the end they would produce the same category of the symptoms like burning sensation, temperature being raised, or at times there could be exudates or fluid discharges present, and abnormalities of the cell count. The total leukocyte count could be altered, and that's exactly the involvement of the pitta. Then, then histamine is another of the. Whenever the injury is due to what we call as the allergic reactions, immune reactions, a foreign substance acting over there, then it may produce the cytokines of different type, and they are called as the histamines. Again, there are some more subtypes of the histamine: H1, H2, H3, histamine 1, 2, 3, 4, and so on. Histamine 2 is mainly in the gastrointestinal tract, which increases the gastric acid secretion, and histamine 3 is it enhances the neurotransmission, alters the neurotransmission, and histamine 4 is in case of the immunomodulation. But the most common variety of the histamine which we see is where the cutaneous allergic manifestations, skin manifestations. And whenever there is a skin manifestation due to the histamine, the characteristic clinical symptom will be itching rashes, which is a very common phenomenon. Whenever you come across any substance which produces the contact irritation, you might have experienced. And I don't think that there is anyone who has never experienced that. And the same in the later stages would be can result in respiratory abnormalities where there could be discharges from the nose, sneezing or nasal congestion, and then dyspnea also could occur. In the gastrointestinal tract, it can produce the bloating, flatulence, and even a conceit, persistent sense of fullness or occasional diarrhea and pain, nausea, etc. And over the nervous system, it can produce a headache and dizziness. and over the circulatory system it produces a tachycardia and hypotension, or even anaphylaxis like condition. It could be collapse. Anaphylaxis also is a histamine released condition. And the skin, the most important is the skin, the pruritus, the flush, and so on. Now, that's exactly what the Samhita would say. Whenever there is involvement of the kapha, is a sneha, katinya, kandu, shitatva gauravam, bandha, upalepa. Upalepa is gastrointestinal tract symptoms, staimitya, shofa, apatti, gastrointestinal tract symptoms, varna shveto, that pallor produced due to hypertension, Swadu Lavanam Chirakarita, a slow acting conditions. Now, the point is, Vata Pitta Kapha Lakshanas, they are not something which is not totally different from the modern concepts. The modern physiology knows about it, it's already described, but only the problem would be that's not utilized in the practical clinical field, but Ayurvedic point of view, it's a practical clinical field as such. Now, a Vata abnormality, the Vata Vyati are very large number. Why those large number of the disease can occur could be due to mutual involvement, mutual effect of one of the types of or one of the functions of the Vata with the other functions. When there is a overlapping or interaction between one function of the Vata with the other, then it can result in the clinical symptoms of different category. Now, we have discussed about the prana, prana, pana, vyana, vatas, their functions we have discussed in the previous session. Now, when there is a involvement of a prana vata with the pitta dosha, then it can produce a typical symptom of the chardi, vomiting. Now, I think we have referred to that issue. When a patient presents with vomiting, the cause for the vomiting could be many. And usually we categorize that cause for the vomiting, the primary gastric abnormality, where either there is an abnormality of the food or maybe the gastric functions, the abnormalities of the mechanisms of vomiting, like muscles, external muscles, or it could be the central vomiting. Now, more important is the central vomiting from the present point of view. When there is the vomiting center is stimulated, chemoreceptor trigger zone in the base of the brain is stimulated, either as in case of motion sickness, or it could be like a intracranial pathology, meningitis-like conditions. When there is an intracranial lesion involved, it can result in vomiting, and that kind of a vomiting which is produced with the central nervous system is the prana, pitta or the prana. Pranavata, which is the higher centers which regulate the respiratory and the other movements of the body, and when it's affected with the pitta, as in case of the toxemia-like conditions, is the pitta or the prana. Daurbalyam sadanam cha chandra vaivarnyam cha kapha. When the same pranavata, the same respiratory functions, when they are affected by the kapha, and there is a histamine release involvement, and then there is an effect of the neurological mechanisms of the respiratory and cardiac functions, it results in a vasodilatation and the bradycardia would occur, and that's exactly with the patient would have hypotension, and often the patient may have a discoloration, that cyanosis also can occur. And that's exactly Daurbalyam, Sadanam, Tandra, Vaivarnyam, the Kapha. So Kapha of the prana is where there is a vasovagal attacks, like where there is an abnormality of the vasovagal symptoms, and there is a tendency for fainting, and as a result of that, the clinical symptoms would occur reaching up to the level of syncope. So that's exactly the thing. Now, all that main purpose of showing all this will be to highlight that all these descriptions which are mentioned in the Samhita, they are demonstrated clinically, they can be seen clinically, and then they can be utilized. Then, Udane Pitta Sanyukte Murchadaha Brahmaklamaha Asweda Harsho Mando Agnehi Shita Stambho Kapavate. In case of Udanavata, when it is involved with the Pitta, it presents with the burning sensation, kapha, and this giddiness, and so on. When it is involved with the kapha, it produces a Asweda Harsho, abnormal sensation, and Mando Agnehi, the digestive capacity would be there. Now, you have a clinical entity called as autonomic dysreflexia. Normally, autonomic functions would always function in a synchronized manner. Synchronized manner in the sense there is whenever there is a need for stimulation of the heart gets stimulated. Whenever there is a need for stimulation of the bladder gets stimulated, and so on. So that's how you will have a normal functions. But there is a situation, and we come across that kind of a situation quite frequently, which we call as the autonomic dysreflexia, which is often produced due to any stressful condition. Many times it could be a psychological stress. At the time of the examination, you may have that kind of an experience that you may have totally impaired appetite, your bladder functions could be affected, sleep cycle is affected, and so on. Or it could occur due to any other stress, like any other chronic disease. Autonomic dysreflexia could be one of the issues. Many times we attribute it to the psychological causes, and the usual treatment would be some and these antidepressants or sedatives are often given, but that's not the real treatment. The real treatment would be due to involvement of either udana vata with the pitta or the kapha. So depending upon that symptom, you'll have to prescribe either a pitta shamaka or kapha shamaka aushadhis. That's the real treatment which can occur, and that's exactly what we do in the patients who have that examination phobia very commonly. My prescription would be usually Kamadugharasa or Agnitundi. That is the usual prescription, and with that, majority of the patients would be managed. Kamadugha for Pittaja and Agnitundi for the Kapaja Lakshanas. Then Samane Pitta Snyukte Sweda Daha Oshna Murchanam Kapadikam te Menmutram Roma Harsha Kapavate. When the Samanavata is involved with either a Pitta or a Kapa, it can produce a abnormality of the gastrointestinal tract functions with either burning sensation or even unconsciousness, or the even more abnormalities of the defecation and micturition. Practically, we can show the demonstration of the pitta and kapha involvement. The upper line GIT findings seen at endoscope, like erythematous or erosive or hemorrhagic gastritis. These are all the signs of pitta involvement of the samanavata, whereas atropic, hypertrophic, and nodular, these are involvement of the kapha one. Yeah. Now again, here also in the gastrointestinal tract symptoms, like whenever we do the gastroscopy, if you have these symptoms of category, upper category, that erythematous, erosive, so on, the usual prescription would be Kamaduga. If it is of the other atrophic changes, the usual prescription would be Agnikini, kapha involvement. So the involvement of Samanavata with the Pitta or the Kapha can be practically utilized with an advanced technology like gastroscopy, and clinically it can be utilized, and practically it shows the results. That's all the point. That's all the point which we have to say. Similarly, the next is Apane Pitta Niyukte Daha Ausnya Syat Asrugdaraha Adakaya Gurupanja Tasmineva Kapavate. When there is an involvement of apana with pitta or kapha, it results in the plexopathy. Now, plexopathy is a abnormalities of the lumbar or these plexus. Of course, you can present with the different sorts of the plexopathies. Clinically, we see more commonly the lumbosacral plexopathy or brachial plexopathy. Now, brachial plexopathy is not involved in apanavata. In the apanavata, it's about the lumbosacral plexopathy. The commonest causes of the lumbosacral plexopathy is a chronic diabetes, or it can be produced due to multiple conditions. Many patients, systemic diseases like tumors, or patients on chemotherapy, or patients who have inflammatory disorders like typhoid, they may result in the plexopathy. The typical clinical symptom will be asymmetric pain in the hip, buttocks, thigh, and vague acid. And to locate this, particularly this picture is the Tinel's test is a test which is done to identify the lumbosacral plexopathy locations. Depending upon the location, lesion, all that you have to do is identify this point, press upon, and this is what we generally clinically do. Clinically, when the patient presents in often a hit of the patients, press upon some areas, and many times the students will be confusing like what is it. Now this is exactly the Tinel's test where the location is done, particularly in case of diabetic neuropathy. This is a very practical useful series of the clinical tests, Tinel's test, which can help you to locate the lesion of the nerve involvement. That's exactly the apanavata involvement, and either it could be pitta or kapha. When there is a pitta symptom, patient would have burning sensation, whereas kapha it's numbness. Now diabetic neuropathies, now most commonly from the clinical point of view, lumbosacral plexopathy is most common in case of the diabetic neuropathy, and the diabetic neuropathies it can present in both the ways, pittaja or kaphaja, and accordingly the treatment also will be different. In case of pittaja involvement, we prefer to have the yapana bastris, Whereas kapha involvement, we give Niruhavastis. So that's how we manage the patients in the clinical conditions. And this is involvement of the apanavata with the pitta or kapha. So that's how it can be made out. Then Vyane pittavrte daha Gatra Vikshepanam Klamaha Guruni Sarvagatrani Stambanam Asti Purvanam Lingam Kapavate Vyane Chesta Stambasta Devata Vyanavata Sarvangagata Vata, where there could be involvement of Pitta or the Kapha. In case of the Pitta Lakshana, there will be Gatra Vikshepanam, rigidity, and the function will be abnormal. Whereas Kapha Javyadi, Kapha involvement, it results in Stambhana, flexidity. Now, it's a well-known, very common entity. Of course, every student will know about the upper motor neuron lesion and the lower motor neuron lesion. The typical upper motor neuron lesion is the sign of Pitta Vata Vata, and the lower motor neuron lesions are Kapha Vata Dhyana Vata. The clinical symptoms, of course, it's well known. Most important is the spasticity and rigidity, the Gatra Vikshepana in case of Pitta Vrta Vyana, and the Kapha Vrta Vyana, it's the hypotonia, the Stambhanam, as the clinical symptoms. And accordingly, you will prefer the treatment. Either it could be Agni Chikitsa like treatment, or it could be the treatment of the Pindasveda, or maybe the Vestis or Dharas, and so on. So that's how it is treated. And the important is these have a practical clinical utility. That's all the point as such, right? So that's about the Vyane Pitta Vrta Vyataha. Now, yeah, now that's about the involvement of Vata with the different doshas. The next part is about specific diseases like Vata, which we will continue in the next session. So if there are any questions, we will try to answer and then wind up. Like there are some questions. Once there was a case of snake bite, which you had started with the Basti treatment. Snake bite should be treated as a Vataja condition. Now, with that particular patient, the patient came later after the poisonous effects were over. The patient came after a week or so, and naturally he had all the symptoms of Vatarakta, and we have treated him on the line of Vatarakta, and he is recovered. Suppose the patient had come on the day one after the poisoning, then the treatment could have been totally different. There, the treatment should have been to the poisoning as such. So, whatever we have done is based upon the clinical presentation at that moment. I think that clarifies the issue. Then C5 and C4 tests will also guide the disease entity. Yeah, that's exactly same. The assessment of the different cytokines also are useful. Now people are starting using that in the identification of the, maybe at least prediction of the prognosis to a certain extent, but that's not yet utilized to the full extent. And there is no need to go for that sophisticated tests to do that. Simple clinical assessment and assessment of the doshas would be good enough to make use of that in the management. And that's exactly the key of Ayurvedic management. When we say the Ayurvedic management, without going into that biochemical tests of assessment of the cytokines, we can make out clinically, and we can plan a specific management. That's all the important thing. See, in the contemporary system, the identification of the cytokines are utilized only to predict the prognosis, and virtually there is no question of changing the line of treatment based upon the type of the cytokine. Whereas from our point of view, we have that kind of a huge accessory or huge paraphernalia, which can utilize this information practically for the clinical field and get the results. So that's where we have an upper edge. That's the point, right? Okay, with that, no more questions. So we'll conclude today. We'll continue in the next session. Thank you.